in 3. Just waiting for Facebook to catch up. All right, we're live.
Good evening, everyone. This is going to be a regular meeting of the Henry County Board of County Commissioners. To stay in line with the COVID directions we've got from the governor, several commissioners will be joining online today. We have staff that will be joining online as well via phone calls. If you have public comment, the public comment portion will be by telephone. If you're on the e-comments, if you've already signed up, and we'll see you once you come in. In order to speak, you'll have to press *6 on your phone to speak, but please hold those comments until we ask for public comment. You will be given adequate time to speak. So at this point, what we're going to do is we're going to open up with the prayer and the pledge. So if you would join us in prayer, Ms. Bird.
Father God, we thank you. We bless your name today, God. Father, as we join in on this meeting, God, we ask, God, that you would be with us, God. Give us wisdom, God, to let us make the right choices, God. We thank you, God, that you have taken us up underneath your wings, God, and you have covered us, God. We thank you, God, for our first responders. We thank you, God, for the wisdom that you will be giving the president, God. And we ask, God, that you will order our steps today concerning this call, concerning the county, concerning the state. In Jesus' name we pray. Amen.
Amen. I pledge allegiance to the flag of the
United States of America.
and to the republic for which it stands, under God,
One nation.
indivisible, with liberty and justice for all. Got a slight delay going, so everybody just kind of be patient if you would. As we get started, Ms. Barano, roll call, please.
This is a regular meeting of the Henry County Board of County Commissioners being held on Tuesday, April 14th, 2020 in the Commissioner Chambers in LaBelle, Florida. In attendance are Chairman Mitchell Wills, County Administrator Jennifer Davis, County Attorney Mark Labb, and Interim Clerk Kimberly Barano. Attending by phone are Vice Chair Emma Bird, Commissioner Darrell Harris, Commissioner Michael Swindle, Commissioner Carson Turner.
Thank you, ma'am. We're going to be going just a little bit slower today, so give everyone a chance to make sure we get a good idea of the audience that are listening. Everyone has an opportunity to pay attention as we go along. The first item of business tonight under the business is ordering and modifying policies of conduct and commission meetings and subordinate meetings due to the COVID-19 public health emergency is the first item on the agenda. I would entertain a motion for that.
Yeah, and let me just offer a couple clarifications just
If you
for the
would,
record.
please.
So we had what I prepared in the packet, but since the packet was prepared yesterday, I modified that a little bit. So the policies that were proposed were adopted yesterday by emergency order by Ms. Davis as county administrator under the state of emergency that we have here because we needed to get the policies in place before the board meeting actually started. So what you're doing is ratifying, or being asked to do, is ratify what Ms. Davis entered yesterday, and the order was provided to the commissioners yesterday. And this basically, for members of the public, just to understand, this is basically the procedures and processes that we're following to do this meeting by what's called communications media technology instead of in person. So that's my recommendation, is to approve the ratification.
Mr. Chairman, Mike Swindle.
Yes, sir.
This is Mike Swindle. I move option 1.
Commissioner Harris.
Okay, we got a motion by Commissioner Swindle and a second by Commissioner Harris. We're going to take public comment on this?
Yep, everybody.
Okay, we're going to take public comment after each agenda item. So is there any public comment at this time? If you do have a comment, you need to press *6. Thank you. Hearing none, is there any discussion on the board?
None.
All those in favor?
Aye.
I'm sorry, we got to do this differently. Ms. Barano's going to take a roll call on this, so just wait one moment, please.
District 1,
Commissioner Bird, aye.
District 2,
No comment. Commissioner Harris, aye.
District 3,
Commissioner Wills, aye.
District 4,
Mr. Swindle, aye.
District 5.
Yep.
Thank you, Commissioners. Under the bids, we're we're good? Okay, the second item on the agenda is under bids 2020-03, construction services in connection with the Lewis Boulevard from Georgia Avenue to US 27. Yes, sir.
Mr.
Chairman,
Shane has.
Chairman, this is, sorry.
Go ahead, Mr. Parker.
Chairman, this is Shane Parker, Public Works Director. I want to modify my recommendation under option 1B to execute the contract subject to county attorney approval. Other than that, my recommendation remains the same.
Commissioner Byrd recommend that they accept that option along with, Mr. Shane just stated.
Is that the form of a motion?
Commissioner, Chairman Wills, this is, Commissioner Turner. I, second Commissioner Byrd's motion, and I will be voting in favor of this.
Okay, thank you, Commissioner Turner. Again, we're gonna be taking public comment after each item. So if there's any public comment at this time, if you would press *6 on your phone, you will have the opportunity to speak. None heard. Any further discussion on the board? Madam Clerk?
District 1,
Motion to accept.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
I think he already put his vote in a few minutes ago. He said yes when he put his recommendation in, so. Okay, it passes. We're gonna be moving to the consent agenda. I would
Chairman Wells,
yes, sir.
I move to accept the consent agenda.
We are pulling
Commissioner
item,
Byrd,
hang on one second. We're pulling item F, Frank 1. F1 is being pulled, Commissioners. Mr. Harris, do you-
accept and pull F1.
okay, thank you, Mr. Harris. Do we have a second?
I second to accept with the notion of pulling F1.
Thank you, Ms. Byrd. Again, we are gonna take public comment after each agenda item. Is there any public comment at this period? If you would press *6 and speak. None heard. Any further discussion from the board?
Chairman Wills, Mike Swindle.
Yes, sir.
Hey, just a clarification, we're gonna discuss F1 further, or are they gonna bring that back at a later date?
Margaret might be able to address that. I'm not sure. Ms. Emblich?
We're getting clarification right now from Mr. Swindle.
Okay, sure. Okay, well, if they're wanting to pull it, and she's not there, then I assume it's gonna be a later date, and that's fine, I was just wondering.
Yeah, before we vote, there she is.
Margaret here. Commissioner, this item is being pulled. It will not come back before you. It's an item that needed to be requested directly by the property owner and not by staff. So that's simply why we're pulling it, and it won't come before you from staff.
Okay, understood, thank you.
Thank you, Ms. Emlis. Commissioners, it's gonna be a little lengthy, but, under recommendation, we have to do the votes this way, so, Ms. Barreto is gonna ask each item, so if you would, just be patient and bear with us. Madam Clerk.
District 1,
I accept.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yes.
Motion carries. Thank you.
Mr. Chairman,
Yes, sir, Mr. Turner.
I wasn't understanding exactly what Margaret said. Ms. Emily said it will or will not be coming back before us.
No, sir, she said it will not be coming back. It was not applied for, and it will not be coming back. It has to be applied for by the landowner, so it will not be coming back before the board.
Okay.
Thank you. On awards and appearances, we have Dr. Joe Pepe is joining us via phone as well. Dr. Pepe?
Yes, good evening, Commissioners. Can you hear me okay?
Yes, sir.
Yes, sir.
Okay, great. Thank you. I will keep my comments brief. Just thank you all for the opportunity to present to you, and I certainly appreciate your leadership in demonstrating social distancing while maintaining an open meeting to our community. I'm very impressed by your creativity and willingness to serve our community. With that, I'd like to dive in to just a quick update as far as the COVID outbreak, where we're at today, some of the actions that have been taken, and where we're headed in the near future based on some models that I've seen. So currently, globally, we're looking at just under 2 million total cases in the world. The United States is sitting around 589,000 cases. We are seeing a global curve change as far as the number of new cases from the peak of being somewhere in the area of 101,000 new cases daily back in the beginning of April the 4th, to where most recently we're at 79,000 new cases. So we are starting to see a downward trend globally, and hopefully that's a good sign. That doesn't mean that all countries are declining. That just means some of the major outbreak areas are declining. However, we are seeing some spread in newer countries and areas that COVID was not before. When we look at the state of Florida, we're at 21,367 cases as of this evening. We have a total of 2,900 hospitalizations, and unfortunately 524 deaths in the state from COVID. We are seeing the same trend that we see globally as far as for the state, with a peak back on April 3rd of 1,300 cases as a daily high to most recently 1,000 cases. So we have been hovering around 1,000 cases a day for the last 4 or 5 days. So the goal is hoping that this continues to be a statewide trend. However, same as I mentioned before, not all counties are the same, where we might see Miami-Dade, Broward, and Palm Beach County, which have 58% of the total cases for the state of Florida, leveling off or potentially a downward turn. We're seeing some increases in other areas of the state. As we know, our cases have been increasing. The daily number of cases per day have been hovering around 2 to 3 new cases a day for the last several days since the 8th. And a lot of that associated with clusters in businesses, facilities, and household contacts. We do not see, based on our data, a widespread community transmission at this time, although it is expected that case numbers will continue to rise, especially since we're adjacent to Palm Beach County, which has a significant amount of cases. And we are working very hard to stem that tide. Big challenge for us is our travel patterns to the southeast of Florida. Many of our citizens work in those counties or have relatives, and so back and forth travel has become a challenge for folks possibly being exposed to COVID in those counties and then bringing it back. When we look at the characteristics of coronavirus and the age category, it is impacting people across all ages. However, the most significant population group that has been impacted, mainly just because the number of people in that age category, is the 65 to 74-year-olds. And the number of hospitalizations for people above 85 years old is 123. To give you an example, put this into perspective, there have been 714 cases for people above the age of 85 and only 123. Now, unfortunately, 123 is too many. However, just to put it into perspective and showing that our hospitals are doing an amazing job in taking care of even our most vulnerable patients. The primary complaint that we're seeing for individuals presenting to the emergency room has been shortness of breath. Cough and fever have now reduced down to levels below that of what was the peak of flu season, somewhere around the end of January, early February. And so we're continuing to see that trend statewide across multiple counties. For Hendry County, we're looking at 23 cases right now, and we do expect there to be more cases. However, I am pleased to report that we are clearing cases. Right now we have 8 cases that we have cleared. So even though we have 23 cases, there's not 23 active cases right now. All but one of those cases are in Clewiston, with one case that was cleared in unincorporated Hendry County. So it's great news to see people recovering and doing well through this. We do have plenty of testing capabilities between the hospital, the community health centers, the health department, as well as we've received some additional supplies, and we are training tomorrow to finish standing up our collection program as a partner with Quest Labs. So we'll be able to continue to support testing, and we're going to focus primarily in Clewiston first, and then work our way backwards into LaBelle and Moorhaven based on need from the community. When we compare Hendry County to the rest of the state, our incident rate right now for Hendry County is 60 per 100,000, when compared to Florida, which is at 97 per 100,000, and New York City, or New York actually, is 1,158 per 100,000. We've tested 318 people, 23 in Hendry, 5 in Glades, and 257 of those tests came back negative, with 31 tests pending, and we've had a positivity rate of 8%, which is suggestive of that we're targeting those high-risk individuals and identifying the positive cases in our community. When we look at the outbreak model, there's several different models that I've been looking at, and the one that has been kind of the most steady and consistent has been the model out of Washington State University, and I compare that with the model being used by the National Guard as well as other models, and they're all fairly consistent with the predicted peak for the state of Florida as well as the United States is somewhere between now and the beginning of May. And when we look down into Hendry County, because our numbers are lower compared to the number of people per capita, the model isn't as accurate, and just because of some errors in statistics. Realistically, we would expect, and I would see where it looks like peak utilization for our community is somewhere between now and the end of the month. So it is too early to let our guard down. And just want to share with you also that we're still seeing influenza throughout the state, as well as in our community. We have had a significant amount of H1N1 cases in the state of Florida this year, somewhere over 11 to 1,200 cases of H1N1. As you remember, in 2009, H1N1 was the novel influenza that was very, very concerning to our community, and we still see that on a daily basis today. So we are also, just to put things into perspective, working through a hepatitis outbreak statewide. However, I'm pleased to report that the social distancing and controls that we put into place for COVID have also had a very positive impact on number of cases for hepatitis A and pretty much other activities as well. So we're very pleased to show how effective social distancing and those control measures have been put into place and are effective. So I thank you all for your support and your help in that guidance. And I know it's not easy for anyone right now, but it's been proving to be effective as far as flattening the curve so that our medical surge is not overrunning our hospital infrastructure. Hendry Regional is doing well. They've done a great job in expanding resources, and we've been supporting all of our medical providers, including Hendry Regional, with additional protective equipment and supplies to kind of keep them protected and be able to serve our community. We've restructured somewhat at the health department to essentially 3 general categories: monitoring, screening, and investigation, and then we have a rapid response team. The monitoring team pretty much is going out doing exactly what you think we would be doing, interviewing people, talking to the community, and identifying who needs to be tested and screened, and working with our medical providers. Then we have our screening unit, which are the people that are supporting all of the testing operations. And then we have our investigative unit, which is our epidemiology team, our nurses, our nursing director, and they work with all of the community partners as well as medical providers to go out into the community and interview those who may have been exposed to COVID and or positive with COVID to try and contain it and mitigate risks to the community. As part of this operation, we've also established a webpage, Stronger Than C19, which is a community action survey. And that survey allows us to gather data from everyone who fills out that survey in order to start to identify those who may be symptomatic, those individuals that are at risk, and the overall vulnerability of those communities. And we're putting all that back into a database in which we're using to model in order to prepare for not only medical surge, but also patient movement in the event that we need to support those activities. Speaking of patient movement, we've pre-staged in 3 counties to our east and then 1 county to our west in Lee County several mobile hospital units. On the East Coast, they're about 1,000 patient each facility, and Lee County is 250 beds to support not only COVID patients, but hospital step down in order to free up the hospitals to support more COVID patients. To date, we've distributed, and I won't go through all of these things, but just some of the highlights, over 10,000 gloves, over 1,200 gowns. We've had several bottles of hand sanitizer in varying forms. I'm pleased to report that our community, including U.S. Sugar, has stepped up to help us produce hand sanitizer, and it's very much needed, especially for our responders. So thank you very much for those who made that happen. Almost 2,000 masks and 5,600 procedure masks and another 1,400 face shields. We've also distributed another 100 thermometers. So one of the pieces that we've seen that is a pattern that we're working through is make sure that our mental health component is supported in our community, and all of our mental health providers have gone to telemedicine, teletherapy, and they also have their crisis intervention teams, and they're all in effect and working right now, and they have not reported that they've been overrun and have been able to support the needs of the community. As one of the areas that we've been focusing on as well is non-congregate housing. We've been working with emergency management and county administrator and our community partners to develop a program in order to support non-congregate housing, meaning that if we have an individual who is COVID positive that we need to isolate, but they do not have a place to stay, we are working through that process now in order to establish protocols and resources for them to have a place in order to support them through their recovery and make sure that they are not spreading COVID to the community. Just as a reminder, I wanted to share with you all just some general thoughts about COVID. The social distancing component is within 6 feet of each other. I've seen many of our retailers really help out with counting the number of people going into stores, and then also even readjusting their aisles so that they're single direction in order to help support spacing. The typical symptoms continue to be fever, cough, and shortness of breath. Although we are seeing about 85% of the people that have COVID have extremely mild to moderate symptoms. However, there is a percentage of population that this hits them pretty hard, and they end up needing some fairly significant hospital intervention. We're still trying to gain a better understanding as to who these at-risk individuals are. The individuals that we've seen so far are people that have significant underlying health conditions, such as cardio and pulmonary issues. And so that's why the recommendation by the governor was to be safer at home. There's a few web pages that we have published, not only with the Department of Health. You can go to the Hendry Health Department webpage with links, as well as to the CDC webpage. And then there's some general guidance as far as use of hand washing, hand sanitizer, staying home when you're sick, and avoiding others who are sick. And I just want to circle back and say thank you all again. I know this has been tough times, and we will learn a lot from this and get better as we move forward, just like we have with every other event that we've dealt with in our community. But I know that we'll get through this, and my prediction is that things will begin to improve within the next 4 to 6 weeks dramatically in order to where we can start to begin some recovery efforts, not only for our community, but also our businesses, to help them get back on their feet and finish up strongly this year financially. And with that, I'll answer any questions you might have.
Dr. Patrick, Commissioner Harris. So we have
Yes, sir.
15 cases right now.
Yes, sir.
Okay, and 1 child, right?
Yes, sir.
Okay, thank you.
Yes, sir.
Hey, Dr. Pepe, Mike Swindle.
Yes, sir.
Hey, so just right at the very end there, I just maybe ask you to elaborate a little more. You said that you think, and I know that there's no exact science unless you can help me understand that as well, 4 to 6 weeks before you think we're back to some normalcy, you know, with regards to interactions, schools, and things like that? You don't think, can I give you an idea of what you think is going to be safe on that?
Yes, sir. That's really the question of the day that we're all asking ourselves. We're looking at this on a daily basis. If the number of new cases continues to decline, and nationally as well as internationally. And our county continues to follow that trend. Right now, we've sort of been leveling off. We've had a few significant spikes, so we're not there yet in our community. However, if we start to see that happen, that's an early indication that we can begin to look at opportunities to start opening back up a little bit more, working with our school districts and our restaurants and folks. And that's really where I'm gonna need your guidance as you're embedded in the community and talking to individuals is how can we best do this safely and not step down our guard too quickly in order to have an outbreak or a rebound effect, if you will. All of the models are stating by early June, we should be well into the decline of this outbreak. And so long as the community and control measures continue to hold. If our community does not follow the guidance, then this will last much longer.
Dr.
Wow, okay.
Peppers, Commissioner Byrd, are we considered to still be in the peak?
Yes, ma'am. The models are all a little bit different, but anywhere between now all the way through to, let's say, the first few days in May are statistically where the peak are right now. The models have been shifting slightly, and I think that's part of, as they get more current data, they're kind of pushing that information in and based on the influences of our adjacent counties. So I'll continue to keep you all apprised on that on a daily basis if I see anything significant to that shift. But it has been wobbling back and forth somewhere between middle of this month to probably somewhere around the end of the first week of next month.
Thank you, and thank you for all that you do. We really appreciate it.
Yes, ma'am, likewise.
Any other comments, commissioners?
Yes, sir. Dr. Pepper, you're saying that we've tested 318 people at this time, correct?
Yes, sir.
That's between Hendry and Glades County?
Yes, sir. Predominantly in Hendry, just because of size of population. Now, that number also can be potentially underreported. We have had situations where people have been tested out of state in other labs, and so that information is not making it back to our dashboard. We did send out some guidance through.
So we're not talking about 100 people, we're talking about 10 to 15 people probably, correct?
Yes, sir. But yeah, I don't think it's a big number.
All right. Doc, are you understanding that Palm Beach County is going to start testing asymptomatic people? Have you heard that?
That has been the guidance in some areas. We will be doing the same as well. As we are waiting on about 500 test kits to get approved by the labs to accept them, and there are some scenarios in which we're going to be testing some asymptomatic individuals, especially in high-risk areas like nursing homes and healthcare facilities and areas where there's close interaction with others. I'm also working through ordering some of the kits that can tell us whether or not you have antibodies to COVID, to show whether or not your body has developed any type of, or has experienced any exposure to COVID, which helps also with our investigation work.
Doc, what kind of dollars and cents are you talking about with wanting to order these kits?
So the test kits for the antibodies is a unit price of $10 each. And so I was looking to order a minimum of 1,000 at first, and then go from there, or 100 rather, so $1,000 at first, just to work through, because I want to gain a better understanding, especially for our first responders and medical workers, what type of potential exposure has been occurring, as well as also gaining a better understanding in our nursing homes.
Doc, do you feel right now, and I don't mean to put you on the spot and hold you to this and say, oh, you know, we need to beat you over the head with a stick on this one, but let's just say, for discussion's sake, off the hip, I don't need an exact number, how many kits, testing kits, do you have for COVID right now between Hendry and Glades County? How many kits do you have? Overall system, not private providers. Health Department, Florida Community Health Center, Hendry Regional Medical Center, how many do we have?
So right now I have 500 kits that are waiting to be approved. I have another 139, 158.
158 in possession right now?
Yes, sir, plus another 500 that we're waiting to approve, so that would be 658.
No, sir, you have 158 right now, right?
Yes, sir, plus another 500 that we're waiting for approval.
How many days have we been waiting on approval for that, Don?
So we received 4 out of 5 approvals as of today, or we are waiting on the 5th one as of today, if not hopefully tomorrow.
And so then that 500 would hit the ground when?
Tomorrow. As well as, yes, sir, as well as, Quest has, pushed forward another 50 as well.
Okay. The point that I'm driving at with this, Doc, is I would like to ask our board and our county administrator to make resources available, and if that's in a financial need, she doesn't have to come back, the county administrator doesn't have to come back to the Board of County Commissioners whenever we're in a state of emergency like this. I don't want us to be standing on principle of we're trying to shop a number. I do understand that Hendry County's not flush with cash, but at the same time, if we need to stroke a check to engage a private lab that is sitting there with 100 or 1,000 test kits available for us to be able to make a resource available so that we can get a little bit more, no, let me rephrase this, a lot more aggressive with regards to testing, I'd like to make those resources available. I think that 318 people tested. We're moving into, we started testing on March 17th, I believe it was. Can you confirm that, Don?
I don't have the exact date, but I know that's when it really started to ramp up in testing, yes.
There, yes. So, I don't know what that does statistically, but when I looked at the statistics the other day as it related to us being, Hendry County being tested, and I didn't even put Glades County into the mix, I felt that we were a little bit under the state's average. You referenced 60 per 100,000. I just think that we, as a community, have the ability to control our destiny a little bit better than relying on Tallahassee or relying on the federal government to give us resources. And I think that if we could align those resources, put them on the ground, by resources I'm referencing completely, into PPE and test, so that we can get aggressive with looking at what is the spread like in our area, and then how are we going to combat that, and then how aggressive do we need to be with saying you have to wear a mask or you don't have to wear a mask, or a mask is just strongly suggested. We can open up different things. We can look at having different industries. We can have a little bit more of a timeline associated with, depending on obviously what the executive orders that come down from the governor are or are released. We can look at opening up and existing again. But 318 people out of 40 plus 15,000, 55,000 people. That's not a lot, and yet we know that we've had a handful of tests that have come back positive in the last few days, and I think that raises everybody's blood pressure. So those are just some thoughts that I have. The final thought, until you comment some more, and if my colleagues have anything to say, is that I am anxiously awaiting to clear up the 33440 zip code debacle. I don't think that you have any say over that. I don't know how that all plays out, and I assume that everybody knows what I'm referencing whenever I say the 33440 debacle, and how the fact that code extends all the way around to Pahokee, basically, and then comes all the way back over to basically the center of the county, and then shoots all the way down to the Seminole Tribe Reservation. And, Doc, you referenced Palm Beach County being our neighbor. The last report that I saw as it relates to the workforce in Hendry County, I believe we have roughly 6,000 people a day that come into Hendry County to go to work. And that goes as far north as Martin County, all the way down to Miami-Dade, with the largest percentage being in Broward County that come into the county every day to go to be gainfully employed here. So I think that we have a lot of things that are coming at us that we don't really have control over. And I just want you to hear loud and clear, and I want my colleagues to hear loud and clear, that if it's just if it's between $5,000 to $25,000 for us to put 1,000 test kits on the ground that are rapid read, some PPE, and get some things in here so that we can look at the Hendry County population specific and the Glades County population specific, and know exactly how healthy or unhealthy we are, how many asymptomatic people are carrying it and potentially spreading it. I'm ready to do that, but that's where I'm standing right now, and I will rely on you as the Department of Health representative for the state of Florida for us to give us your best recommendation, along with the other health professionals out there, But my personal opinion is we need to press the gas harder. Thank you very much, Doc.
Yes, sir, and I hear you loud and clear. We've reacted to your comments, and, you know, that's part of the reason why the Quest Lab support, we're looking at least supporting easily 50 tests a week there. And then with the additional testing that we're doing through Henry Regional, the convenience care, as well as what we're doing, we're looking to drive that number up significantly. And another piece of where I want to really drive up the asymptomatic testing is in those areas that we talked about, because that is a major concern. We have seen people with very mild symptoms that were COVID positive, and that's concerning because I don't want those individuals traveling within the community, not even realizing that they have COVID. So I hear you loud and clear. We are definitely ramping and rapidly working towards that.
Other comments, commissioners? Dr. Pepe, again, thank you for all that you're doing. We know that you've been very, very diligent in this, the Henry County health system throughout Clewiston and LaBelle as well. We know you guys are working very hard, many hours. The question I would have is the test kits we do have, say we drop 1,000 more tomorrow, does that mean you can test 1,000 more people tomorrow, or are we testing what needs to be tested now? I mean, where are we really at? If we
So we have, yes, sir. We haven't turned anybody away from testing, and we've had enough tests. What we haven't had the ability to do until recently was to open up more testing, just because the limiting factor was the actual collection kits. Now that we have those, we're ramping up even more, and then with the support of Quest, we'll be continuing to open that up. So between Henry Regional with their drive up, as well as what we're supporting at the health department, we should see a fairly significant increase in testing over the next week or two. And my understanding is that there are another significant push of test kits coming down from the state as all part of this approval process. They already told us that once these are approved, there's going to be another significant push out to all of the counties. So my guess is we'll probably receive another 500 to 1,000 test kits again.
Okay, just to follow, like Commissioner Turner was saying, we want to make sure that we're doing what we can do, everything we can. So that's reading the question was a follow-up part of Commissioner Turner's statement there. So again, we appreciate all you're doing, and just keep us, you know, we're relying on you. You are the expert, you are the professional. So we're relying on you to keep us where we need to be. Is there any other from the commissioners? I think Commissioner Swindle just flew off.
I promise that's not me.
Mr. Lapp, do we need to take public comment on this, or
No,
this is just a presentation, correct?
Right, it's up to your discretion, but you do not have to because it's not a vote.
Okay, well, Dr. Pepe, again, thank you so much, we appreciate you, and if there is anything Henry County can do to get behind you and push you, let us know. I believe you're hearing the push here is let's do what we gotta do to make sure the people of Henry County are safe. So again, thank you, and just keep us abreast.
Yes, sir. Thank you very much all for your support.
All right, thank you, everyone. We're gonna be moving into the public hearing portion. This could be just a little tricky, so we're gonna try to navigate through this. So, first thing on the public hearing tonight under A, petition. Ms. Assemblage, or you want to read that out?
Yeah, Margaret, read the agenda title for the record.
Is ordinance repealing ordinance number 2020-02.
Okay, this is an adoption hearing, it's a hearing of the public.
Well, she's got a little bit more to say about it.
Okay.
Okay. So commissioners, the county is the applicant for the next two public hearings, and pursuant to the order adopted by the board at the beginning of this meeting regarding conducting this meeting by means of the communications media technology, I, as the representative for the county on these quasi-judicial matters, waive the right to cross-examine witnesses and waive the right to challenge the validity and adequacy or constitutionality of the rules and policies adopted by the board earlier this meeting. These statements are necessary to comply with what you all had ratified in the beginning of this meeting. So having said that, the first public hearing agenda item, as we already stated for the record, is a ordinance repealing ordinance number 2020-02, which was adopted on January 14th. Unfortunately, there were missing sections in the ordinance, and so we need to repeal this ordinance. And as you know, the next agenda item will be another action that would adopt the complete ordinance. The ordinance has all the attachments that are required. And so for this particular agenda item for the repeal, I'm here for any questions, if you have any.
Thank you, Ms. Emmons. Again, this is a public hearing, so if anyone in the public would like to address this at this point, if you would press *6 on your phone, you will be able to speak. We'll give you a few moments to get there.
Commissioner Wills, could you just tell us when you're ready for a motion?
Yes, sir, just one moment. About 3 or 4 more seconds. So we're trying to give them 10, 15 seconds to make
Yes,
sure we don't have a delay.
understood.
So, and then,
Okay.
yes, sir, we will entertain a motion at this point.
Commissioner Wills, this is Commissioner Swindle.
Yes, sir.
I move option 1 to repeal the ordinance.
Do we have a
Commissioner
second?
Byrd, I second it.
Thank you. Motion by Commissioner Swindle, second by Commissioner Byrd. Is there any further discussion on the board concerning this matter? Madam Clerk.
District 1,
So moved.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yep.
Motion carries. Thank you. Assemblies, we can move on to B.
Yes, thank you, Commissioners. This is the adoption of ordinance that would be for the, regarding the Everglades Airport. We would be amending Chapter 1-53, the zoning section, specifically Section 1-53-617, Everglades Planned Industrial District, and rezoning land from the APID district and A2 zoning district to a newly created zoning district called Airport Operations Plan Development. And in addition, creating a new section, 1-53-6.19, the Airport Operations Plan District.
A motion that we accept the ordinance.
Okay.
Commissioner Byrd.
Do we have a second?
This is Commissioner Swindle. I'll second the motion.
Okay, we have a motion by Commissioner Byrd and a second by Commissioner Swindle. This is also a hearing of the public. At this point, if you're on the line, you would like to speak to this, we'll give you a few moments. Remember to press *6 to speak. Hearing none. Any further discussion on the board? Madam Clerk?
District 1,
So moved.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yep.
Motion carries. Thank you. Mr. Lapp?
Yes, Mr. Chairman, members of the board, this is regarding the golf cart operations on county roadways. As you know, we have an ordinance already in place for this. We amended it a couple months ago to allow nighttime operation. And then at the February 25th meeting, the board directed that I proceed with an amendment that would allow the operation of golf carts in the Pioneer community during the daytime. So what I've got in front of you is an ordinance and 2 resolutions. The ordinance is an ordinance amendment, and what it does is it amends the ordinance to specify that nighttime operation may only occur if the resolution for the particular neighborhood allows nighttime operation, and that generally it's daytime operation only. And so that's the ordinance amendment. And then you also have two resolutions, one for Pioneer, which basically says operation is allowed during the daytime in Pioneer on the roads specified on the map, and I sent you a corrected or a clearer map on that. It would basically be all of Pioneer south of what is popularly known as the depot, and then that would be allowed, and then north of the depot would not be allowed. And then you also have a resolution for Harlem community, which already has the allowance for golf cart operation, and you already approved that map, but we needed to specify for that community that nighttime operation is allowed, because that was the intention of the board expressed earlier. So we have each of these items, and we do, one of them is an ordinance amendment, so it is a public hearing.
Commissioner Wells,
Yes, sir, Mr. Harris.
Mark, can you explain the night for Pioneer?
Right, there will not, as this is set up, nighttime operation will not be allowed, so only between sunrise and sunset within Pioneer.
Okay, why is Harlem different? Why do they want to drive at night?
Well, I can't speak for why they want to, but previous to tonight, the only neighborhood that had the authorization from the board to operate the golf carts at all was Harlem. And so the board authorized that in 2018 for Harlem, and at that time it was daytime only. And then in January, the board adopted an ordinance amendment that said you can operate at night if you have the right equipment. And so that was an amendment the board approved, so it allowed nighttime operation in Harlem. And so that's where we stood in January, and where we still stand up until right now. And now with the addition of Pioneer, my understanding at the last board meeting, or 2 meetings ago, was that for Pioneer, the intention was daytime only. And as far as why that should be daytime for Pioneer and nighttime and daytime for Harlem, that's a board decision about what you want to allow.
Yeah, they really don't need to be on the road at night. If they want to, I guess, okay.
Mr. Harrison, Commissioner Byrd,
Yes.
they already was riding at night and the daytime in the past. We just wanted to make a wrong right to help the situation out. As long as they have the right equipment, I believe that it would be okay.
Okay.
Mr. Chairman, this is Commissioner Swindle.
Yes, sir.
Yeah, so, I would like to ask 2 questions. One is to kind of follow up on what was just said with regards to riding at night. And I believe, if I'm not mistaken, what I heard that community say was they didn't want it at night while we were at that meeting. I would love to hear what Commissioner Turner's district, I'd love to hear his input, and even the rest of you, what you heard. And secondly, Attorney Lapp, I'm sorry, I haven't seen it, maybe it's there and I've just missed it, but with regards to insurance, you know, if we're allowing them on the road and they cause damage, they cause a wreck, they run through a fence, something, you know, and destructive, are we requiring them to have any insurance where we have a recourse for them to pay for damage they caused?
You want me to take his question first, Mr. Chairman?
Yes, sir.
Okay, so there is nothing required as far as insurance. The state legislature has kind of directed the landscape, if you will, for what is allowed for golf cart operation and what counties and cities can do and not do. And there's no mention of insurance in the state statute. I think it would be, I think it would go beyond our authority as given in the statute. But then even aside from that, administratively, it would be challenging to enforce that kind of requirement because just as far as, I don't know, they don't get registration. You don't get a registration for a golf cart like you do for a motor vehicle. So I don't even know how you would enforce that, and it's even commercially available, but I don't know.
Okay. All right, because at one point we had talked about some sort of not registration, but yet an inspection to make sure that they were up to par, give them some sort of set sticker or identification sticker that had to be present on it. But okay, and I would love to hear what my colleagues thought about, and yourself, you know, and maybe even, you know, Ms. Davis. You know, I don't think that we have any, as far as I know, in Harlem or City of Clueston, that there hasn't been any damage, but just trying to think with the, you know, with the proactive safety hat on, if said golf cart caused damage or ran into my vehicle or something, you know, that's, I don't know if we're opening ourselves up or ourselves as landowners or, you know, for losses.
I'm not sure how that would fall into the Florida no fault either. Again, you know,
Yeah.
the enforcement of it is gonna be the biggest issue. We talked about the stickers. The stickers were mainly, I believe, spoken about in Pioneer. And the object there was to make sure to just identify who the homeowners were and then who the ones for coming outside were. But again, and I agree, Commissioner Swindle, I'm really anxious to hear what Commissioner Turner, again, I was there at the meeting that night, but he has met with him several times since, so.
Mr. Chairman, we've only had, 2 other meetings since then. Obviously, you know, my plan was to have 2 weekends in March, but that all got kind of kiboshed with the COVID. And, I wanted to be wrapping this discussion up by the end of April, and then coming back to you all with succinct suggestions on how we're going to move forward with, all of the different OHV, golf cart, go-kart, motorcycle, horses, you know, this, that, and the other in Pioneer, and what we're hearing directly from the community, and then also working within the constitutional allowances so that we can or cannot say, you're not from here, you can, or you're not from here, and we can't tell you you can't. So, you know, a lot of that's been put on the back burner, unfortunately. I will say that Pioneer specifically said, I heard them say, we don't want to be operating at night, and so that's kind of what we're moving forward. And the gist is, we want to crawl before we walk. Let's open it up to golf carts. Let's see how well that's received. I personally think it's going to be received very well. I think the map that staff has designed that shows it from the Pioneer Depot going back south, and then, you know, kind of hoping that the people out there will understand we don't want you taking it in Henry Isles all the way up to 80. I think that we're staying out of the most dangerous parts. We're on pretty much a straight shot from there if you are on Henry Isles. And I think we're making a stride in the right direction. So that's pretty much it in a nutshell.
Commissioner Turner?
Yes, sir.
Just to be clear, and Attorney Lapp, that at one point, I thought we had talked about them not being able to traverse Henry Isles Boulevard, but if I'm reading this map correctly, they can. Is that what y'all are wanting to happen?
Yeah, so I think that what we kind of, and I honestly don't even remember who I talked with about it, and maybe it was staff members at the community meeting, or maybe they heard back from the community, but the gist is the Pioneer people want to have the ability to be able to drive their golf cart and go check their mail. And you know, if person X that lives on the east side of Henry Isles wants to go visit person Y on the west side of Henry Isles, and Henry County Sheriff's deputy happens to be crossing down Henry Isles, while this person is taking Arcadia from east to west, or taking Homestead from east to west, or, you know, any of the other roads that cut across there, they don't want to say, oh, look, I caught you, now I got to write you a ticket because you were on Henry Isles. So we kind of logically said, Henry Isles from the depot south is a straight shot. So you have the ability to see them. You're already sharing the roads with a lot of other things that aren't legal out there. Let's try to clean it up.
Okay, understood.
Sounds good. This is a public hearing, so does anyone in the public would like to speak to this? If you would, press *6 on your phone and have the comments. Nothing being heard, I'd entertain a motion on this.
Mr. Wells,
Yes, sir.
I move to approve.
Commissioner Byrd, I move second.
Thank you. Motion by Commissioner Harris, second by Commissioner Byrd.
Just to be clear, that's approval of the ordinance amendment, the resolution for the Pioneer community, and the resolution for the Harlem community.
Yes.
That is correct. Any further discussion from the board?
Mark, I'm sorry, Commissioner Wills, Mike Swindle. Hey, I'm sorry to do this to you, and I did write down, you just said 3 things that we're voting on, and I don't want you to go through and read all of them again, but would you please give me the quick, the ordinance, so that I'm clear on exactly what it is I'm voting on?
Yes, sir. So the ordinance amendment makes a change to the wording of the current ordinance to provide that generally golf cart operation may occur only during the daytime. But the board, when it designates a community as being available for golf cart operation, in that same designation, the board could choose to say that nighttime operation is allowed for that community. So nighttime operation is a community-specific judgment by the board each time.
Okay.
So that's the ordinance amendment. And then the 2 resolutions, one for Pioneer, this is the first resolution for Pioneer, for Pioneer, that says, okay, golf cart operation is allowed. And it says specifically, no nighttime use. And then we've got a resolution for Harlem, which kind of amends the earlier resolution for Harlem, which says nighttime operation is allowed.
Got it. Thank you, Attorney Lapp.
Ms. Merida?
District 1,
Motion to accept.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yes, ma'am.
Thank you.
Motion carries. Thank you. Mr. Lapp?
Yes, the next item on the agenda is amendments to our procurement ordinance. You last amended this in May, and at that time I had moved a lot of the provisions of the ordinance, the procurement ordinance, into a policy to give you some more flexibility to amend it and deviate from it when we needed to. In doing some research on another matter, I found that construction services procurements need to have, the procurement needs to be pursuant to an ordinance, not a policy. So this moves that, the procurement specifications, or a lot of them, back into the ordinance. There are still some provisions that are just by way of policy. So you have 2 documents. You have an ordinance, a procurement ordinance, and then you have procurement policy dealing with different subjects. There's in your book were, track changes that showed all the differences. And I did include language that gives you some flexibility to deviate from the ordinance when the board makes a judgment that deviation is necessary on a case-by-case basis. So the recommendation is to approve both the ordinance amendment and the resolution adopting the amended procurement policy.
Thank you. We have a motion for that?
Mr. Chairman, this is Commissioner Swindle. I'll move the motion.
Thank you.
Commissioner Harris, a second.
Okay, motion by Commissioner Swindle, second by Commissioner Harris. This is also a hearing of the public. Anyone in the public would like to address this, if you would, press *6 on your phone and make your comments. Hearing none. Any further discussion from the board? Ms. Merida?
District 1,
Yes.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yes.
Thank you, motion carries. Moving down the agenda, I know FYI, everyone saw what we had there. Staff reports, is Ms. Davis?
Yes, Chairman, I have one item before you, and it is requesting to be able to proceed with the necessary steps to revoke the exemption for the ATO tax exemption.
You need a motion on that?
Yes.
Mr. Chair,
Yes, sir.
before we take action on this, Jennifer, I tried to piece together what exactly the dollar amounts are that we would be looking to recoup. What is it, 24,000 and some change? Is that correct, or is it a portion of 24,000 and some change?
It is $24,000 and some change, as far as I believe what they've paid, but I do believe there are some outstanding taxes, so the direction was to be able to proceed with any and all amounts, even if they were outstanding.
I think that, I mean, are we gonna hire outside counsel, or are we gonna let Mark represent us on this? I'd love to know, before I take action on this, I'd love to know what kind of dollars we're talking about receiving. And then I'd just like to caution the board that we're dealing with an entity that I think is, I don't know if they're going through growing pains. I don't know if they're going to be bankrupt. I don't really know what their background is. I know that they've given us a song and dance, us being a county, a song and dance for quite some time. They've asked for a 1-year extension. I think in June or July, they'll be bearing down on that 1-year extension. And I'd love to have a bit more detail from our county administrator of knowing exactly what kind of dollars and cents we're talking about potentially recuperating to the dollar, and how we're going to go about trying to do that. Because if we're going to lock up our court system, if we're going to lock up our county attorney, and we're going to receive $30,000 2 years from now, or versus we don't file suit and everybody can go about their business, I'm interested to see. And if it's less than a threshold, I don't know what we're talking about here. I mean, this is one of those ones where we swing with our eyes closed and we hope we get a base hit, and that's how we are conducting with these tax exempt statuses. And I don't know if y'all recall, but we had everybody and their dog in the chambers telling us that the City of Clueston's board meeting, it was the Henry County board meeting in the City of Clueston's chambers, how we needed to do this. We needed to actually be more aggressive with our tax exemption. They were very upset at us that we didn't give more than what we did. And if we didn't do that, we were going to lose this company to Glades County, Michigan, or Tennessee. That was the ending people that they ended up going to. And they, then when they did come to Henry County, if we didn't sweeten the deal in the 11th hour, we weren't going to get their second facility. I don't know if y'all recall that, but they were getting ready to break ground on a second facility, and we had to sweeten it. And so that was a threshold that caused us to sweeten the deal to get to where they are. And they didn't like the slide scale that we designed. And so they've done nothing that is holding true to what Ms. Papinal and I think Brent Kettler worked very hard to get them from the state of Florida. And they've really missed on a lot of their end of the deal. And we've not missed on our end of the deal. But I'm just afraid that if we run up more cost and more dollars and cents to our bottom line to try to recuperate a nominal number, I don't know where it's going to end, because you can file Chapter 11 or you can file 31 different things that say we don't exist anymore and you're out. And we're also dealing with a potential international player here. So that's my 2 cents. I want y'all to take that into consideration. I will not be in support of this right now at this time. I'm not saying I won't get there later. I'm just saying I'd like for Ms. Davis to give us a little bit more research and detail before we pull the trigger on it. But I'm all about, y'all outvote now.
Commissioner Will?
Yes, hang on one second, Commissioner Swindle. Mr. Lapp's gonna give us a little clarification on some of this.
Okay. Yeah, thank you. That's what I was going to ask for.
Yes, sir.
Right, so this is not a request to initiate litigation. The step that you would be directing or authorizing staff to proceed is to schedule for a public hearing the revocation of the tax exemption ordinance. So it would be an ordinance act, an adoption of an ordinance revoking the earlier ordinance. So that's the first step. And so, and then that would stop the continued eligibility for the exemption, because the the property appraiser is preparing the roll and going to be putting out a trim notice here in August. And based on the existing ordinance on the books, she's going to include an exemption amount for ATIO unless this board stops that. So this will prevent the continued granting each year of the exemption for this coming year and every future year. So that's really the main thing you're achieving. Then secondarily, once it's revoked, and we would send a demand letter to them saying, okay, now pay the exemption that you got and pay it to us. And then we'll see what comes of that. And if we felt like it was worth litigation, or the board felt like it was worth litigation, that would be a future vote, not this vote. We come back to you and say, okay, authorize us to file a lawsuit. And that, I'm not at all recommending that tonight. I'm just saying get the ordinance adopted to stop the continued granting of exemption amounts to this company.
Attorney Lapp?
Yes.
So in the event they go to sell, which is plainly in the write-up, if whatever we levy or revoke or move down the roads are revoking, a new company would need to pay those taxes. That would be part of the agreement that we would be paid that before transaction could be complete. Is that correct?
Well, I don't think so. Would not, it's not an encumbrance on the land. See, the taxes are an encumbrance on the land, but the taxes
Yeah.
that they were assessed included an exemption amount, so,
I see.
so
Okay.
the exempted amount is not a delinquent tax amount. It's,
Okay.
and so it won't tie up the real estate transaction. Now, you may,
Yeah.
in a future, if the future landowner wants to get an exemption, then, you can consider whatever you want as to whether you want to allow it.
Okay. Even if we revoked it, if we went down the path of revoking it, where it still wouldn't be an encumbrance on past taxes. It's only moving forward.
Yeah, it's a debt of ATIO. It will become a debt of ATIO once it's revoked and not paid. Once
Yeah.
the ordinance is revoked and they don't pay the past granting, it is not an encumbrance on the land.
Understood. I understand perfectly, Commissioner Turner's and comments, but I do realize that this particular, action is different than moving forward with litigation. So if there's no further, discussion from my colleagues, then I'll move a motion.
Discussion.
Go ahead, Mr. Harris.
Jennifer, did you say they, owe 24 plus taxes?
So I believe that the 24 is what they've already received for the taxes they've paid.
That's not.
Okay,
No?
so that,
Okay, so the 24 includes a current tax bill that they haven't paid.
Right, I can address.
oh, okay.
Mark said he can address it, but then we have the future role that we're concerned about as well.
So they got the exemption for 2 years. The tax bill for, they got an exemption for 2 years. The tax bill for calendar year 2018 that was due by March 31st, 2019. And that, their assessed value was pretty low back then. They didn't have a lot of the equipment. And we're talking about tangible personal property. We're talking about equipment in the building. We're not talking about the land or the building itself. So they didn't have much equipment in there. There wasn't much tax on it, but they got a 40% abatement on what was there. And from a tax dollar per amount to the county, it was like a few $100s was their exemption, their benefit for calendar year 2018 paid in spring 2019. And they paid that. They paid their tax bill. They didn't pay their exempted amount because they were exempted, but they paid what they owed. And then for calendar year 2019, they added equipment in there. Their value went up. Their percentage went down because that's how the ordinance was set up. It was a stair step down. So it was 30% exemption for 2019. The tax that they were exempted from for county ad valorem was $23,000 or so, give or take a few hundred. And so that was a pretty significant exempted amount. And then they also had an amount due, that they needed to pay. And my understanding, well, at least according to Ms. Hammer, as of the write-up here, as of March 12th, I don't know where she got a date in here somewhere. March 17th, she checked, and they hadn't yet paid their 2019 taxes at all. So they didn't pay the exempt amount, of course, because they were exempted, but they also hadn't paid the amount they were supposed to pay. Now, I don't know if that's changed since then. I don't know if Ms. Hammer looked into that or not. So I don't know if that clarifies it.
Okay, Mr. Chairman Wells?
Yes, sir.
I second his motion. I
Okay.
second his motion.
Thank you. So we have a motion by Commissioner Swindle, and a second by Commissioner Harris. Is there any further discussion on this topic?
Chairman, I was going to close out with, I can't support it. I don't know, their amount is 160 that they haven't, 160,000 they haven't paid. If it's the payment total of 1,400 that they haven't paid, I would love to give a breakdown and see this, because I think that what this is going to do is this is going to put a real education to us as a board as to what it means when we start handing out tax exemptions and how it all plays out. And, what is this new entity's contribution to our bottom line, and then what are we allowing them to exempt and not have to pay? Or what are we allowing them to be exempt from paying, and what does that number look like? I'm not being disrespectful to any of you all, but I think that it's as clear to you all as it is to me, and I've looked at a number of details in this packet. My blood pressure gets up whenever I look at the packet that they presented to us, and knowing the inability for us to have systems of checks and balances, and I think that this would be a great conversation that we bring Keitha in. We all, we white paper this, we have a great presentation about this, and we've learned from this example, instead of, we're sitting here now gonna say, Audio, give us, I don't know if they're gonna give us $24,000 or $1,400 or $160,000, guys, I don't know. But guess what we're gonna get, Zero, and I understand what Mark is saying, we're just gonna revoke the option to say that. What I'm saying is, just hit the pause button on everything, we'll honor our 1-year commitment that's asked us for, and then we'll say to them, maybe they'll come to the board meeting, we'll be able to hear them tell us exactly what they're gonna do to our face, or are they selling, and then we can get on board with whoever that new entity is. But, I can't support action tonight on this, so, I'll be voting against it, but if that's what y'all want to do, but I still think we need to have the conversation moving forward. Thank you.
Thank you, Commissioner.
Chairman Weld,
Yes, sir.
Mark,
Yes, sir.
can you hear me?
Yes, sir.
Did you say the, last year's taxes hadn't been paid?
Ms. Hammer looked into that, and as of March 17th, they hadn't been paid. I don't know.
So, just as a couple comments, so the amount is, and it's in the write-up, $24,240.89. The number that is not in the write-up, and the reason I kind of expanded the language to include anything else is because I don't know what's not in the write-up was the amount that would be on this next year's taxes. And as Attorney Lapp just spoke, the tax roll, whatever is brewing, in other words, that is going to be coming out, I didn't want to exclude whatever that number was. But as far as through 2019, it is $24,240.89.
Right, thank you.
And also to clarify, tonight, if you vote in favor, you're not revoking the exemption. That will have to be scheduled for a public hearing, and will be an ordinance at a future meeting.
Okay. Thank you.
So actually, Commissioner Bird, we're just voting to move forward with this, Mark.
Yes, just to take the next step to advertise for a public hearing and put it on a future agenda for consideration of revocation.
Thank you.
Yeah, and you know, I have heartburn about this, I always do, because if I have a business and I come to your county, I shouldn't have to come here and ask you for a handout. My biggest problem with this is they have done nothing they said they was going to do. Of the 39 employees, I read there was 15. So obviously they have done nothing they said they
Have
were
15
going to do.
people employed. I guarantee you they don't. I can't speak for them, but I guarantee they don't have 15 people employed.
I'm just about to tell you the same thing, I agree with that. I've actually been past the facility, and I've got to agree with that 100%, so.
And we need to allow public comment.
Commissioner Bird, just for the record, I went over several times to meet with them, and they was actually busting out of Palm Beach County. It was not local. So I tried to interact with them, and I was not successful.
Again, I have the same issues and reservations, and I don't believe they're gonna line up, and, so it's just a couple problems. Commissioner Lapp has some clarification you wanna bring in?
Well, I just wanted to say that you're getting ready to vote, and so we need to allow the public comment before you vote.
Okay, I didn't see this as part of public.
Well, it's not a public hearing,
I
but
remember, yeah.
we're allowing.
Got me. It's also here, if you wanna speak to this from the public, if you press *6 on your phone and speak now. Nothing heard. Ms. Barrow.
District 1,
I motion that we move forward. Yes.
District 2,
Yes.
District 3,
No.
District 4,
Yes.
District 5.
No, and I'd like to add a point to it, but I'll just let the vote go how it falls. If the chair would allow me to just give a little bit of direction after the vote is taken.
Yeah, absolutely, Commissioner Turner, go ahead.
Mr. Chair, I would just ask Jennifer if you could find a way to kind of, give us a presentation as it relates to this. This is the first time in my memory, that the board is taking an action that I think is correct to, revoke the status, but more importantly, is we're having a conversation about a performer that promised us a lot of things. And I'm gonna say it like this, guys. They got up in a public meeting and they essentially threatened us that if we didn't give on X, Y, and Z, they were gonna go elsewhere. And I think it speaks directly to the tools in the toolbox that we have or need to develop and how we're gonna move forward with that. So that's, I don't know what all that looks like, but I think that we need to have a much deeper dive on this. And the last thing that we need to be cognizant of is what are our current existing places of business hearing from us when we give the outside performer from Italy or wherever they are from, Kalamazoo, Michigan, we give them things that we will not give the person that's been here forever and gainfully employing people that are here. We're giving it to them and they're not performing, and we're not. I don't think we should be giving out things to those that are already here that are wanting to expand. But yet I don't think that we should be looking at these tax exemptions the way we've done it historically also. So that's it. Thank you all.
Good. Commissioner Wills, I'd like to just tag on, and I absolutely couldn't agree more. You know, we got businesses here that want to expand, and that's the conversations I've had with businesses. They break their backs, they're employing 20, 30 people here, and they want to expand, but and we do things for companies we don't know anything about and have no knowledge of, and then this is what happens to us. The only other one, Commissioner Turner, I would say, I think was the prison down south. I think we went through the same process with them as well.
It is.
Yeah, and it was more aggressive, Commissioner Swindle, and they probably performed more poor. And then we also, guys, I'm pretty sure we did this for bionitrogen, and it's just, you know, I'm proud of staff. I'm proud of anybody that's been involved, Jennifer, that has tried to follow up and find out what Osseo has done. This is the first time in my memory, since I've been on the board in 2008, that we've actually drilled back down and said, look, we on our board back right now have an application that shows exactly what they told us they were going to do. And then y'all clearly went down there and done some research. And then it sounds like at least 4 out of the 5 of us have been down there to kind of put our own eyes and ears on the place. And it's not occurring. What said was going to happen did not occur. But y'all remember, the chambers were filled. We had to do this. And look at here. This wasn't a base hit. This was a home run. 39 jobs, median average of $42,000 or $43,000. You know, this was making it happen. You know.
Okay, that motion carried. Mr. Lapp, you're still.
Yes, sir. So, what I have in front of you is the declaration, ratification of the declaration and the extensions of the local state of emergency. We had the initial declaration, plus we've had 3 extensions so far. So the recommendation is to ratify those actions.
Second, Commissioner Byrd.
Yeah, we got a motion by Commissioner Turner, a second by Commissioner Byrd. Any public comment on this agenda item? Who would press star 6? I may have a nightmare tonight about star 6. Commissioner Turner, you did make that motion, is that correct?
Yes, sir, that's correct. This is just for item 1. This is not for emergency contracts, correct?
Yes, sir, just item 1.
Yes, sir.
Any further discussion on the board? Ms. Barano.
District 1,
So moved.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yes, ma'am.
Thank you.
Item number 2, Mr. Lapp.
Yes, next item is ratification of emergency contracts. Under your state of emergency ordinance, the administrator has certain purchasing authority, and she exercised some of that this past week with a contract to buy some meal kits for needy residents of Hendry County from Hope Hospice. So it's clearly within her authority, but of course we want to get some reimbursement from FEMA for this. So just as a protective and conservative measure, I like to have the board ratify her action and her contracts so that there's never any question about, for reimbursement purposes. So I sent you the one contract, that's all we have so far, so I ask that you ratify that contract.
Chairman Wills, Commissioner Swindle, also moved.
Thank you.
Second with discussion, Commissioner Turner.
Thank you, Commissioner. We got a motion by Commissioner Swindle, second by Commissioner Turner. Discussion. Yes, sir.
Mr. Chairman, or Jennifer, whoever wants to answer, what was the contract amount and what was the need or population base for that need?
I can address the amount, now let Jennifer address the need. It's 300 meal kits at $4.82 a meal for a grand total of $10,122.
And the need was
Did you say
for seniors.
3,000?
No, $10,122 for 300 meal kits, and the kits, I think, have there's 7 meals per kit.
And it's for mostly senior folks that needed food with the order where they're supposed to be at home and sheltering in place and not having the ability to go out. And there were 7 meals in a box, and we worked with Hope Hospice to be able to use some of their suppliers to be able to assist with that need.
Mr. Chairman, that sounds like a really good idea. I've been inundated lately with and when I say lately, I mean like in the last 96 hours, with local entities wanting to engage this process as well. And I would just ask Ms. Davis if her, the Department of Health, thought that this might be something that we could also look to facilitate with our local people. And I think that we'll be shocked at some of our restaurateurs and them wanting to engage this and help and facilitate as well.
Yeah, the senior, and part of that issue, we have a food bank every week, but part of the issues are the seniors can't come. And the food bank for the seniors is only once a month. We do that as well. There's about 250 participants every month with that. But the problem is that they really don't get a lot of items, and it's not gonna last a month for sure. So I understand, and there is a lot of public interest in meeting these needs, so that is something we need to vet for sure. So if anyone of the public would like to speak to this, if you would, *6. Hearing none. Any further on the board? Ms. Perry.
District 1,
Motion to accept.
District 2,
Yes.
District 3,
Yes.
District 4,
Yes.
District 5.
Yes, ma'am.
Thank you.
Motion carries. Thank you.
Mr. Chairman, one housekeeping item I wanted to bring up, and we can maybe do this now or at the end, but it relates to your next meeting. And I just wanted to confirm that the board's intentions in that regard. If you want to have it on the 28th, the fourth Tuesday, 5 p.m., do it here like we're doing now, or if you want to provide any other direction on that.
I think we need to kind of look and stay where we're at, and it's working. We got all the bugs worked out. IT has worked extremely hard to get it rolling, so I think it's my opinion we should go ahead and stay where we're at. It's working. Let's don't try to reinvent the wheel. So that's my opinion. Yes, sir.
I agree. Based on what we've heard, we're still going to be toward the peak, by, at that point in time, according to what our fix said. The only question I would have be from Ms. Davis, she, I know she may not know everything that needs to be on there now. Is it going to be, do we need to do a second meeting this month? Is there things that need to be, handled? Or can you just wait until the 1st of May? Or kind of lean on Ms. Davis then to give us a direction on what she needs to have happen?
I think we're okay to wait to do it like we would normally do the second Tuesday of the month, as normal. This one is large, of course, because it incorporates our March and, our last meeting in March and this meeting. I don't think the next one will be as bad, but I'm not aware of anything pressing that we need to do something before then.
So you're talking about the 1st of May then?
Yeah, that's what I meant. Do you see us needing one then, April 28th,
Oh, I see.
is what
That was
Yeah.
the question, yeah.
I don't know, so you wanna talk at March?
So,
We would,
Yeah.
we would need to look at our public hearings and see what we have on tap, and,
There's no public hearings, I can tell you that, because
Okay.
they haven't gone to the LPA yet, but I don't know about Shane's things that he works on.
contracts and so
Yeah.
forth.
well, I think, I speak for all of us when I say that if we need it, let's have it, but if it's not needed and you can consolidate everything to the 1st of May, then do that.
yeah, first meeting in May,
Yeah, but just to be clear, but you
and
say,
what you're saying,
yeah, when you say the 1st of
first
May,
meeting, okay.
just to be
That'll
clear.
be the 12th. The 12th of May.
No, May 12th.
I knew you said it there.
Do we have to have the answer today?
Well, I need to, when we're doing these virtual meetings, there's special advertising we have to do. We have to do an ad each time, a newspaper ad. And so, in order for me to run an ad that makes it in the newspaper by, we're not gonna make it tomorrow, of course, so next Wednesday, if we're gonna meet on April 28th, we have to run an ad next Wednesday. So, and I need to get the ad to the paper by first thing Monday morning. So I really need to know now whether you're gonna have a meeting on April 28th.
So if it's not pressing, then what I'm hearing is we move it to the 12th, and that'd be our meeting for May.
Mr. Chairman,
Yes, sir.
this is Carson. The only thing I would add to it, and I'm not saying that we don't need to move it to May, but I would just say that I think that unfortunately this may become the new norm, depending on how things flare up or die. And I think that we should be prepared. I think this is our first go around. I absolutely hate this. I can't stand it. I dislike it. I loathe it. I don't know if y'all can tell that I don't like it, but I don't like it. But it is what it is, and we're gonna have to learn to deal with it. I would be a proponent of us still having the meeting 14 days from now, because I also think that it allows us to adjust to the new normal. And hopefully, with any luck, we're gonna be done with this by the end of May. And we're gonna be able to get back to some sense of normalcy, whatever that's gonna look like coming out of this. I also think that if we disrupt the schedule too much, it creates a situation where staff, we do have to have a longer agenda, so it just makes this that much more difficult, if you will. And so I think if we can keep the agendas lighter, and we can be done with a meeting in an hour and a half, hour 45, like what we're doing right now, I think that we'll actually have a smaller meeting next time, and I think we'll be better at it. So that's just my 2 cents.
I don't disagree. I have no problem with that.
I don't disagree. I mean, it doesn't matter. So that sounds like a plan.
So we'll plan to meet April 28th, 5 PM, virtually.
Is that good with everyone?
Agreed. Swindle said fine.
Commissioner Bernstein.
We heard you, Mr. Harris. You kinda got stepped on there. We got you.
Okay, okay.
Thank you. Last thing on the staff reports is, Mr. Parker, Shane Parker.
Yes, Chairman, I have 2 items. The first one is supplemental local agency program, which is a LAP agreement for safety improvements to County Road 835, which adds $1,691,000 to the contract, and I'm seeking, board approval of that. And this
I'll
will
make a motion to do that.
I'll second
Commissioner Swindle,
Commissioner Byrd.
Okay, we got a motion by Commissioner Turner, second by Commissioner Byrd. This, again, if anyone in the public would like to speak to this, if you press *6 on your phone. Hearing none, any further discussion on the board? Ms. Barrett?
District 1,
Yes.
District 2,
Yes.
District 3,
Yes?
District 4,
Yes.
District 5.
Yes, ma'am.
Thank you.
Thank you. Motion carries.
Chairman, the next item I have for you is the master agreement with Parker and Ledger Smith Architects for the Henry County Jail. This is an item the board previously approved back in February, but my staff report was muddled. This is just confirmation that this contract is to be approved subject to county attorney approval. And you've already approved STA number 1 to this contract under consent.
Commissioner Byrd, I motion to accept it. I second.
Can we got a little messed up there. Can we do that again, please?
Commissioner Harris makes the motion.
Okay, I got you.
Commissioner Byrd seconded.
Thank you. We got a motion by Commissioner Harris, second by Commissioner Byrd. Also, if you'd like to speak to this from the public, press *6 on your phone. Nothing heard. Any further discussion from the board? Ms. Fairman?
District 1,
Move to accept.
District 2,
Yes.
District 3,
Yes?
District 4,
Yes.
District 5.
Yes, ma'am.
Thank you.
Okay, that completes the agenda. On the e-comments tonight, we had a comment, commissioners, that was sent in by Anna. Her comment was made, the CDC compliance with the stores that were open, she was asking if they were complying with that. She listed several stores, as convenience stores around Williston and LaBelle, was the Dollar General, Dollar Store, Dollar Tree. And the question she was asking was about CDC compliance. Just to throw 2 cents worth in, we really, if we can stress the urgency of this, if we completely comply with these guidelines, we're gonna see this dispense quicker. It's gonna go away a lot quicker. So, I don't think anyone's actually visited these stores to see what that is. We've had several calls over the last several weeks, but just my opinion is, to answer the question, Anna, we're trying to keep everyone as close to the CDC guidelines as possible. Social distancing is really important this time. So commissioners, would any of you like to address that?
This Commissioner Byrd, we just, it's probably not that they don't want to comply. Nobody probably never addressed it them. Walmart is a bigger entity, so, they have a guideline to follow, and they might not have that same guideline. I think we just need to address it.
Any others?
Yes, sir, Mr. Chairman. I think that, you're looking at all of the entities throughout the county. I don't know what we asked the Department of Health to print out and to put on, and I don't know if we put the county insignia next to it as well. I am very much in favor of the county insignia on a sheet of paper that has the Department of Health insignia on it, and preferably both cities as well. And I think that we need to ask people to socially distance. I think that we need to ask all of our vendors to come into compliance with limiting the number of patrons in a store. I think that a lot of people are doing it very well. I'll use Canyon Drugs as an example. If you drive by their facilities, you can't just walk in. The Dollar General store that I visited up in Okeechobee, they have X's on the floor, where you stand, and they're only letting X number of people in at a time. But I drive by some parking lots, and yeah, while the numbers are miserably low, I still see collections of people that are, it's too great of a number of people, and they're in close proximity. And the sad thing about it is that with our best efforts, it still is going to undermine all of it if we have people that aren't adhering to that. And so I think that Jennifer, you need to visit with Dr. Pepe and your cohorts in both the cities. And I think that we need to get a media campaign out there. Chairman Wills, you've already done a little bit of media on this, but I think that we need to push a little bit more until not only is the curve flattened, but it's on a downhill slope.
Mr. Chair, I do know that, Randy and them did pass out some papers in the city, limits to different business for them to comply. Because I got phone calls, just to ask that have been lifted and different things like that, but I do know that they did pass out papers. So then I think it just needs to be a follow-up.
Chairman Wells.
Yes, sir.
Walmart and the dollar stores, they're running as normal. They're not doing anything.
Walmart has gone to only a X amount of people per 1,000 square foot of the building, Mr. Harrison. I've seen several lines. The first day I saw a really long line there, and actually the line was worse than to being in the store. They were right on top of each other, but they have went to the guidelines, X amount per 1,000 square foot in the store.
Yeah, they've changed that. They've opened all doors and everybody's flooding in every door.
Okay, well, we definitely need to address those, and, no, I agree, Commissioner Turner, that's a really good idea. If we get the signage up, English and Spanish both, so everyone can see it on the doors, you know, let them know that we're taking this seriously, and we're asking you to please do the same thing, so.
It's just hard to enforce it.
Well, we're getting out social media, that's getting out there, but not everyone's seeing it, that's the problem, so. Any further comments on that? Jennifer, anything you want to add to that, or?
We have all the flyers and the infographics, if you will, that we've been pushing out, press releases, social media. I do know that some of they've been printed out. Some of them have been passed out at some of the businesses, and we'll continue to do that. We can work on creating something like you were suggesting, Commissioner Turner, with our logo, maybe city logos, and the Department of Health. We did get the Department of Health to do some signage for us last week, stop signs, if you will, for some private businesses for people to stop and do certain CDC guidance requests, if you will, before they enter the premises. And so the Department of Health did that for us, created some posters for Hendry and Glades County. So we could do something similar to that, maybe put some county logos, city logos on there as well, with some different information. And we will continue. We put out an advisory yesterday for everyone's benefit to, again, urge everyone to follow the CDC guidance. And we put out a few advisories. And I believe that a lot of people are complying, and they are taking it very seriously, because it is something very serious. And everybody's got to do their part, and we've all got to work together in order to beat this. And I think most people are, but there's always going to be work to do to make it better, and we'll continue to do that.
Anyone else? Okay, that was the only e-comment that we had. Business by district, District 1.
Commissioner Bird, first of all, I just want to say thank you to everybody. I know everyone's trying to work hard and make sure that we have our social distance, and I appreciate all the pastors, as leaders. That's who we're going to follow. Most of our people are going to follow whatever they do. So just want to be appreciative, and like I said in the prayer, thank God for keeping us under his wings, and that's all. Thank you.
Thank you, Ms. Bird. District 2.
Jennifer, on the census, is your staff working on that? It's been postponed some, right?
We are still working on that. We're continuing to push out all the information for people to fill out their census. You know, we have Facebook, different press releases. We have stuff on all of our emails throughout the entire organization, on our footer, if you will, to remind everyone. And it is something that's very important. And so, you know, right now a lot of people are home, and it'd be a really great time for everyone to make sure that they fill out their census report. Depending on the results, it matters for every entity, city and county, everywhere. And our revenues are comprised of a formula, if you will, of who fills out the census. So the more people that fill it out, the more our county will benefit from that in the future. And it's every 10 years, and it's really important that everybody fills that out. So if everybody could take the time to do that, especially right now, it'd be a really great thing for your community.
Right, thank you. Anyway, in closing, I'd like to thank Jennifer and staff, Emily, and what she's been doing each day. Dr. Peck and his staff, Richard and his staff, EMS, Sheriff's Department, and all of them for what they're doing, going through this storm. Sounds like another hurricane, but it's not. Worse. And I understand the fire department did a great job, was it last week, with all the fires? And we'd like to thank them for their dedication. And most of them volunteers, I understand. Thank y'all very much.
Thank you, Mr. Harris. District 4?
Yes, you know, and I'm sure all of you have been doing the same thing and getting the same calls, you know, that we're all probably getting the same ones. We each have our respective communities, you know, that are in need of help. And I'm in no different situation. Specifically, I've been working diligently with the Montura community, trying to help identify resources for their needs. They had a great delivery today from H.E. Hill Foundation, and there's some great leaders there that are working really hard. There are some religious-based groups that are really getting after it and doing a good job. And you hit the nail on the head, Commissioner Willis. It's mainly that elder population who struggles with being able to get out and get to town, and probably don't need to be out to start with. And so kudos to our staff and everyone. I know they're coordinating food drops from Harry Chapin, and I would encourage, you know, not only staff but my colleagues there as well, that, you know, as you identify resources, if you need to share or can share, and if we have some that we can share, we'd love to be able to do that to make sure that everyone throughout the county, especially the elder population, got what they needed. So thank you for that. And by the way, I filled out my census online. It took like a matter of a couple minutes, so I definitely encourage everyone to do it.
Thank you, Commissioner. District 5?
Yeah, you know, my list is usually long. Try to concise it tonight. So, you know, very simple, low-hanging fruit. Shane, the margarita curve signs are gone. I don't know what happened. Jennifer, I'm hoping that you can talk with Keitha and Emily. I think maybe a source to find out what our unemployment figures are looking like. And then I think that we need to have a powwow set up. Keitha's been sending out a lot of different reports, and I've been impressed with what I've seen her engaging. Everything that I'm reading right now is saying that the community lenders, the small community banks, the first banks of the world are going to be the people that save the day for the small business community. And I think as much as we can align resources, Jennifer, with you, allowing for Keitha and anybody that you see deem appropriate from a staff standpoint to help these small businesses in our area. And I don't mean just in Henry County. I mean, if a small business comes to you from Glade County and they need a computer system to sit down and someone to hold their hand and walk them through the Small Business Administration or the rainy day fund that is out there for payment, payroll. You know, there's a number of different resources that are out there, but I will tell you, it's intimidating. And some of our small businesses may not have the ability to do that and or the resources to engage that. So I think that we should have an all call that lets people know about that. Number two, the unemployment figures. I think the quicker we can wrap our brain around that and look at how hard we're being hit and then push back on that, I think that's going to be an asset for us as well. And then number three, you know, we had a pretty robust capital improvement plan and a pretty large line of credit that we were willing to use. And Jennifer, I think that we need to hit the pause button on anything that is not absolutely essential. And I'd love to hear from you all if you disagree with that, and I'd like to try to lobby you to understand. I think Commissioner Harris, he articulated that very well when he said, this is like a hurricane, but much worse. And I don't think we understand what the financial ramifications of this are going to be for quite some time. I don't think that we have the capacity to understand what the financial hit we're getting ready to take is. And so, you know, other than the Parker Mudgett Smith jail build out that we're doing with the roof and plugging some holes back in some things, I think that we need to tidy up some projects, and then we need to hit the pause button, because I think that dollars and cents are going to get mighty tight here pretty quick.
Commissioner Kernan. Mr. Kernan.
Yes, sir.
Anyway, I agree with you, and I think you're going to see people that can't pay their taxes and different things like that, and all the small business people, they're not going to have any money. So we better just tighten our stuff up and don't do anything unless we have to.
Yes, sir.
Because it's not going to be good financially.
Is that it, Commissioner Turner?
No, sir. The final thing I would say is that, my profession allows for me to have to travel, to a lot of different areas. And, I'm not knocking anything that we're doing right now, but I just want to tell you all about a few different things that I've seen in the last, 5 to 7 days that I've been in Okeechobee County extensively, and I've been in, Monroe County. Monroe County, very nicely, but very directly. Me and 3 of my employees walked into their version of Save a Lot, and I often wear a buff over my face, especially when I'm working outside, or I have a bandana around my neck and one around my face when I'm outside. And I just happen to have my buff up above my face as I'm walking in with my construction vest on and everything. The lady looked at me, looked at the 3 guys that were behind me. None of them had their stuff pulled over their face. She very directly said, excuse me, you all need to go back outside. And I said, ma'am? And she said, you're okay. And so I kept walking, and I said, y'all need to fix something. And then they asked what we do, and she said, your faces aren't covered. And that was pretty shocking. And then you look around, and there's 7 other people in this grocery store, and everybody has a mask on, surgical or a bandana, or even just one of the fishing buffs, or a hunting buff to cover their face. And it's wow. That's something you've never seen in our country. And then when I paid attention, I looked at, there was a form, and that's where I got the idea of a Henry County insignia and Monroe County emergency management. And they give the CDC guidelines. It's very plain. It's literally an 8.5 by 11 sheet of paper with like 4 bullet points. And if you don't follow these 4 bullet points, you will not be allowed in. And then you start to pay attention. There's 2 or 3 people standing outside. They're waiting on their partner or whoever it is that they came there with. They're not allowed in, so they're letting them get their groceries. And in Okeechobee County, they have a really impressive thing right now where it seems like everybody is limiting who can come in, but a lot of people have, and I know I'm not saying we have to do this, but I think this is a great idea. There's probably 4 or 5 stores up there that have a sink set up outside. They have hand sand available, and they have water available, and they have the guidelines for how to wash your hands. And they're providing that resource. I think that's pretty awesome. And Monroe County had the item on there that anyone that requests hand sanitizer while you're in the facility, they have to give you a couple squirts. It seems so simple, but it's very effective. And so just some things to contemplate there. I'm going to say it every time you hear me talk for the next 30 to 45 days is we can't just flatten the curve. We got to get it on a downhill slope. And you all know I'm a very social being. I love talking to people. I love touching people. Every time I turn around, if you told me to sit on my hands and tell a story, I probably can't do it. But, and I also can't not talk to you without touching you on the shoulder or touching you on the elbow or shaking your hand or hugging your neck or just hello. And I don't get to do any of that now. And I absolutely hate it. Not only that, but I don't even get to see Commissioner Harris and aggravate him. So, it's just, these things are, hopefully they're temporary more than they're going to be long-term, but we've got to stay the course. We've got to beat this down because this is unlike anything that we've seen, and I hope that everybody can hear the severity, and I hope that we'll continue to share that message on point. Thank you, Mr. Chair. Good job tonight running this meeting. This is weird.
Yes, sir, it is. I've missed seeing all of you up here with me, so. Just to echo what several of you already said, we can't stress enough how important it is to take the safety measures. It's a lot of residents who ask the same questions. I get the same questions many, many times. And some of the questions there really isn't an answer to right now. Between the health department and all of the scientists and specialists that are working on, the biggest answer is protect yourself. Practice social distancing. If you don't have to go to town, don't go to town. It's pretty simple. Don't just go to town out of boredom. A lot of people get bored because you're sitting at home. Well, don't get bored. You can go outside and find something to do, I'm sure. Trim the trees, trim the grass, water, whatever. You can find something to do. But I think the biggest thing we have to get across right now is self-protection. Make sure that you are protecting yourself. Our first responders, it's amazing the way they've been working. Mr. Harris, you touched on the fires, and I asked several times the other night about structures, and there were structures in the path of that with the fire department. They were able to save anything like that. So that's pretty incredible. You know, times are really hard. These men and women are living in stressful situations just like the rest of us. Yet they're still putting their time into the public out there. So we do need to make sure they know how much we appreciate that. The staff of the county is the same thing. You know, we appreciate the work they do, and the fact of it is, you know, we're all the same. One's no different than the other, and we all have the same needs. But what we need to look at right now is coming together as one and trying to make sure that everyone has what they need. If you have extra, make sure you help with others, and that's what it comes down to. The meetings are a little strange right now. It's a little different, but you know what? We're still here, and we are going to get through this. No matter how strange it may feel right now, this too shall pass. We're going to get through it. So there was one portion I left out before I completely closed tonight, and that was the public portion. And again, if you have something you'd like to say, press *6 on your phone, and you'll be able to come in. Nothing being heard there again. Carl, you and Ryan did an amazing job. We appreciate it. Jennifer and staff, Emily, y'all, we know you're pressed. I see the emails. I know you're busy. Thank you for all you do. Let's continue to try to keep Henry County as safe as possible. God bless you all. Meeting adjourned.